I want to welcome to those of you who are joining us. Bienvenidos a todos que nos acompañan. You have joined the COVID-19 and prisons webinar, and we'll be discussing centering human dignity across decarceration, reentry, and operations. This webinar is in partnership between Vera and Milpa through the Restoring Promise initiative, along with collaboration with a few of our distinguished guest presenters. My name is Juan Gomez. I'm the executive director at Milpa and the co-director of Restoring Promise. I am from the Tatilan Kawatecan Nation of the Ataque Pagame clan, birds that live by the river. I'm also of Chichimeca descent, and I'm formerly incarcerated. I'm going to be your moderator today, along with my colleague, Alex Frank, who is the project director and co-director at Restoring Promise. So just for a little bit of housekeeping, this webinar is scheduled for an hour and 15 minutes. You'll be able to submit questions throughout the webinar, and we'll have a Q&A section at the very end. But first off, I want to kind of take the time to acknowledge the indigenous people from this continent and Turtle Island in the four directions: earth, wind, water, fire. I also want to take the time to acknowledge those who are inside and outside of prison, working on ideas and solutions day and night to address this pandemic. To the brothers and sisters who are locked up and who are working inside of these prisons. To the numerous families, advocates, and formerly incarcerated working to bring them all home. We also want to applaud the many efforts like ours who are working to address and provide guidance around COVID-19 that focus on decarceration, safety, well-being, reentry, housing. A special shout out to individuals at Amend, the ACLU, Vera, the Center on Juvenile Criminal Justice, Mass Design, many others. It's important to note that there's no silver bullet. This is definitely a time where this pandemic is threatening to harm and endanger hundreds and thousands of lives. There's many efforts on many fronts, and many of us are trying to find a balance between scale, pace, and urgency, while being mindful that our lives are at stake. Recently, there was a federal stimulus package, and there's going to be a bailout of companies. I'm hoping that we're also thinking about bailing out lives and saving lives and getting folks out. There's going to be different opinions on this webinar. There's different methods. There's different audiences. Individuals on this webinar have operated, operate, or advocate at different parts of the process and spectrum and system. And it's not as easy as just sign this. So we're really proud to be able to have this unique panel because there's a lot of things that need to happen. Issues of release, de-densifying, social distancing, decarceration, release. There's stuff that that can happen before prison, in the front door, and at the back door of prison, and even on the streets when they come out. So that's important to know because there's a lot of fear, there's a lot of anxiety, folks trembling, trying to figure out how to do. So this will take an intersectoral process of health, the government, private volunteers, nonprofit groups, different individuals. And right now is the time to bring to scale ideas and solutions rather than just criticize folks oftentimes. So about that, want to take the time to also talk a little bit about Restoring Promise. Restoring Promise is an initiative seeking to disrupt the American prison system by focusing on improving the living and working conditions inside of Americans' prisons. We focus on young adults, 18 to 25, because this population is just different. They return to prison at higher rates than any other age group. The racial disparities at this age group become acute. They're disproportionately represent sizable reports of incidents in facilities. They're sent to solitary confinement, disproportionate rates. We work in 6 states, in Connecticut, South Carolina, North Dakota, Idaho, Colorado, and Massachusetts, one of them being jail. Our framework sits within an anti-racist practice and applied values, and we operate these values through the auspice of cultural healing, restorative justice, racial equity, and family and community partnerships. We have 4 core strategies, and that's around scaling up. We're looking to be in 10 states in 3 years. We're looking out to build evidence. One of the things we have going is we have the very first random control study that's looking at if our efforts are addressing violence and potentially leading to a decrease in violence within institutions. We have a global exchange where we take officials who work in prison overseas to Europe and to visit and discuss with different prison officials in Germany and Norway around different ways that we can address mass incarceration, centering human dignity. We're also looking at a strategic communications kind of strategy where we're not just talking about communications, but about mass narrative change. So with that said, I want to talk to you a little bit about the purpose of our webinar. And our purpose of our webinar is going to be to address COVID-19 by aligning prison operations with public health guidelines. We're looking for strategies designed for people, not just pathogens. Our goals with our webinar is to share strategies for approaching prison decarceration and reentry, and share strategies within the existing scope of commissioners and directors, legislators and governors, legislative staff. But we particularly want to identify policy change recommendation and discuss strategies for securing such changes, especially in housing. We also want to share recommendations for aligning public health recommendations within the realities of prison operations while centering human dignity. And we want to share lessons learned from Colorado Department of Corrections, and we also want to discuss other innovative national practices that are emerging and what Department of Correction commissioners can do. At the end, we'll have a part where we can have a Q&A section. We'll kind of have a fluid feedback. I want to introduce our panelists kind of by section in the agenda. So first on the agenda will be Mike Lawler. Mike Lawler is an associate professor of criminal justice at the University of New Haven. He was a criminal justice advisor to former Connecticut Governor Ann Malloy during 8 years in office. Mike was a member of the Connecticut House of Representatives for 24 years and chaired the Judiciary Committee there for 16 years. Prior to his election, Mike was a Connecticut state prosecutor. And Mike will be talking about big picture decarceration strategies requiring governor or legislative action. There'll be a series of questions. Next will be Scott Semple. Scott Semple is a former commissioner of the Connecticut Department of Corrections. He retired in 2019 after serving more than 30 years in the field, beginning as a frontline corrections officer. Scott now serves as a consultant to Vera and several other criminal justice organizations. And Scott will be talking about bold action for decarceration by Department of Correction leadership. Next on the line, we're gonna have Andre Stansel, Deputy Director of Prison Operations of the Colorado Department of Corrections. He has a master's in criminology from Regis University. Prior to his current DOC career, Mr. Stansel retired from the Federal Bureau of Prisons. Mr. Stansel began his Bureau of Prisons career as a correctional officer and continued to hold positions of increasing responsibility. In 2015, Mr. Stansel was appointed as a member of the Senior Executive Services Commission by the Attorney General of the United States. And he will be talking about aligning public health recommendations and human dignity within prisons. There's a lot of stuff coming from Colorado, so we're lucky to have Andre. And lastly but not least, we have Richard Cho, who is a PhD and is Chief Executive Officer of the Connecticut Coalition to End Homelessness, an organization that coordinates statewide efforts to end homelessness through policy and program design, training, and technical assistance. He has worked in this field for over 20 years, and he has designed and implemented policy and programs in the homelessness, behavioral health, and criminal justice sectors. He previously served as the Deputy Director for the U.S. Interagency Council on Homelessness, Behavioral Health Division Director at the Council of State Government Justice Center, and Director of Innovations and Research at the Corporation for Supportive Housing. And he'll be talking about strategies for security and reentry support. So now for your featured presentation.
So hello, everybody. Trying to deal with the technology here. It's a little bit of a challenge for an old guy like me, but It's great to have this opportunity to kick off the discussion here. The experts that are going to follow me can give you very specific advice on specific issues. All of them are at the very front lines of dealing with this crisis as it relates to the correctional population and jail populations around the country. But my role here as a former politician, as an advisor to Governor Malloy, and I guess to some extent my experience as a lawyer and a prosecutor, is to talk about the overarching strategy that needs to be a part of any advocacy effort if the goal is to reduce the number of people who are incarcerated during this pandemic crisis. And I think to begin to think about this, it's important to understand how complex the process is. So in other words, that there's not one single proposal, one single executive order, one single mechanism that can get you to where you want to be. I'm most familiar with Connecticut, but I've worked in states around the country, and I've come to understand that every state is completely unique. And so it's important not to see an executive order perhaps issued by one state's governor and assume you could just photocopy that and apply it in your state. Each state has multiple mechanisms for releasing people to prison, from admitting people into prison. There's all types of different small levers that can be adjusted that have a dramatic effect on the number of people actually coming in or going out of our correctional systems around the country. So let me speak about that just briefly. First of all is the front end. We know that frontline police officers around the country are beginning to understand how important their decisions are in deciding not just who to arrest, but who to seek bail for and ultimately to admit to a local jail or a correctional facility. I think, based on my experience in the last week or so, that police officers are starting to understand the importance of being selective on who you identify who needs to be incarcerated. And systems have a variety of mechanisms even after defendants have shown up at the front door of the county jail to decide whether we need to keep them or not. And what you've seen around the country is some sheriffs are identifying options that are available to them to not accept or to release someone who has recently been arrested. So those are mechanisms at the very front end. And then beyond that, when defendants get to court, prosecutors and judges have a variety of mechanisms available to them to not admit people, or if they've been held for a couple of days already, to release them. So you have to understand at the very front end, there's a whole variety of mechanisms which maybe each one of which yields only a relatively small number of reduction in people admitted to prison, but collectively, all of them together can result in some pretty big numbers. On the back end, every state and every county has a variety of release mechanisms. And so, for example, here in Connecticut, there's at least 11 different early release mechanisms available to correctional officials. I mean, we don't have county jails in Connecticut, but our Department of Corrections serves the same purpose. But for sentenced offenders, you know, there's not just parole, there's not just compassionate release, there's a variety of things. We call it transitional supervision for short-term sentenced prisoners. We've got reentry furloughs. We've got a nursing home option. We've got a DWI offender option. We've got multiple options to identify people who do not need to be incarcerated right now and transition them back into the community. And even inside correctional facilities, there's mechanisms available to prison wardens. For example, the allocation of good time credits, and in some states, extraordinary good time credits that are available in extraordinary circumstances. And I think everyone would agree that we are confronted with extraordinary circumstances. I think people have now come to understand the fundamental justification for limiting the number of people actually incarcerated to the smallest number possible at this moment. Because it's not simply a matter of looking out for the best health interests of those who are incarcerated. It's also a matter of the churning effect, the cycling effect in and out of especially county jails, of people coming in just for a few weeks or a few months of incarceration, then coming back out again. In Connecticut, which is a small state, we admit over 1,500 people into our correctional system every month, and we release over 1,500 people every month. This churning is taking people from the street, putting them in our facilities, holding them for a short period of time, and then releasing them. And you can just begin to understand, and I think people have come to understand this, that if the contagion begins to spread in a correctional facility, it's not just affecting those people who are incarcerated, it's affecting the staff, it's affecting the family of the staff, it's affecting the people who recently released people will encounter once they get out into the streets. So the goal is to reduce the prison population as much as possible during this crisis. You know, hospitals have come to acknowledge the importance of delaying or canceling elective surgeries. And I think what we're really talking about here is canceling elective incarcerations. We can debate whether they were necessary in the first place, but in this time, I think it's an important talking point to say there are some people who absolutely need to be incarcerated. They pose a very real public safety danger to the community. But most people incarcerated don't meet that criterion. And I think that should be the goal of whatever emergency orders can be rendered at this time. The final thing I want to say, and this is something I learned from experience, people on the front lines need to hear clear direction from the people at the top of the chain of command. So governors, legislative leaders, mayors, elected prosecutors, judges, once they say that they understand the importance of reducing the prison population in this crisis rapidly, then people on the front lines will feel a level of comfort in making those kinds of decisions. I think, as we all know, many people in the criminal justice system are very concerned about an individual decision to release somebody that might turn into a tragedy tomorrow. That's a real and legitimate concern that many people have. And that's why it is so important to receive direction from the very top, announced in press conferences or by op-eds or however it needs to be communicated, to build that level of comfort on the very front lines, because it's on the front lines that the people have the power to rapidly reduce the number of people incarcerated in any jurisdiction in the country. So that is the best advice I can give you, is find ways to convince the political leaders, the elected leaders, the criminal justice leaders in your jurisdiction to give a good housekeeping seal of approval of not incarcerating people who do not pose an immediate public safety risk to our community. So with that, let me turn it over to my colleague who's already been introduced, my former colleague, former Connecticut Commissioner of Corrections, Scott Semple, who is, in my opinion, one of the most prominent correctional leaders in the nation.
Thank you, Mike. You know, never before has our correctional system been challenged to the degree that it is right now. I think I speak for everyone who's participating today, and I just want to begin by thanking you all for your exceptional bravery and during this global pandemic. It is especially important to recognize, as Mike alluded to, our frontline correctional professionals who are putting themselves in harm's way and deserve a great deal more recognition from the general public that they get. You know, systems currently operating in what is being commonly referred to as hotspots, by now already are realizing that the status quo is simply not good enough. You are making history in unprecedented times. We are learning from you, and I rest assured we will get through this. In my view, what we're dealing with now is trying to apply effective crisis management techniques, and this will be the key for decision makers and our administrators who are tasked with implementing a comprehensive approach to the current dilemma we're facing. It is an unprecedented moving target, which makes it so difficult. With regard to the question of decarceration, which I feel falls under the category of a bold initiative, we know that already some jurisdictions have implemented decarceration options to address the vulnerabilities that they're currently facing. And it is an important consideration which requires a balance between effective operations during the legitimate pandemic scenario balanced against successful application of CDC guidelines and other guidelines designed to optimize existing health risks to the general population. Ultimately, I think you all want to do your best to best protect the public, incarcerated populations, and the staff tasked with managing the correctional environment. I was having a conversation earlier today and learned that a number of state jurisdictions have come up with executive discretion or orders to decarcerate their populations. That is consistent with what we're seeing in a lot of county entities. So you are already taking that bold approach. You know, the Council of State Governments recently posted an article, which we can make available to you, about what we should be considering when enacting community placement under these conditions. And I would suggest that you go to their website and read this. It's timely and useful information. The article suggests that decarceration is complex and can have negative community implications or consequences without appropriate planning or consideration. In essence, incarcerated people will need to have a safe place to go. Now they know their public health obligations and also have knowledge and access to resources appropriate to their determined assessed needs. An open the door and let them out scenario will no doubt be disastrous to public health and safety interests, and I think everyone knows that. We know that many of you participating today have your own set of unique challenges from an operational perspective, and that was alluded to earlier. Some of you have limited infrastructure options, and many of you face significant staffing vacancies. What immediately comes to mind are the potential susceptible areas within our correctional facilities where social distancing, as it's called, becomes challenging to say the least. And the best example I can offer that comes to mind for me are dormitory settings. Arguably, this may be the worst case scenario as it relates to social distancing. And I'm particularly concerned about agencies that have a heavy reliance on them or lack of alternative housing due to capacity issues. So decision makers who do apply safety decarceration options, they also need to think about how to optimize created housing space as a result of that population reduction. Examples may be prioritized, where to place your most vulnerable populations in safe living conditions to promote optimal social distancing, such as placing older or health compromised incarcerated people in single cell living quarters. I've also been asked or heard and read that mass incarceration has contributed to the challenges that we face right now. That is likely true. Decarceration under the current circumstances may allow for further discussion as to how the back end of the criminal justice system is applied, along with its impact on public safety. The future outcomes of systems enacting decarceration options are certainly an opportunity for us to learn far more down the road. So let's see what the data tells us as a result of these responses. So what can we do now, and what should we be paying attention to? There's plenty of things that should be said or could be said today, but I don't have a lot of time, and I thought I'd give you a list of some of the things that I would take into consideration if I was sitting in the decision-making chair. First is understanding that we all have our own unique and complex issues, and here are some thoughts and considerations. Do you know what your statutory authority is for community release options? Who is currently eligible? Who is eligible now, and who is pending? And who you should potentially target? Is the potential of an executive order on the table right now? And is the agency prepared to provide the impact of that order to the decision makers that people may need to make that decision? Do you have an appropriate complement of staff to process release packages right now under these circumstances? If a decarceration plan is currently not on the table, I would recommend that you prepare one with potential implications, anticipating that the peak of this pandemic may require emergent consideration. I don't think you want to get caught behind the 8 ball. Listening to the news today, I'm hoping to say something more hopeful, but the people on the news are saying expect April to be very challenging. Have a plan and keep reviewing any existing plan to consider housing placement options as a result of population reduction. We should learn from the current hotspots, regions in our country that are more advanced in the acceleration of this issue, and dedicate and avail ourselves to resources that may dictate decision making. Learn from the good and the bad. Know what collaborative resources through your partners are available to you to expedite your plan. And I think this is key, to maintain an open dialogue to ensure that they are in the know of any potential plans that would require their services or expertise. Housing, and today you have a health expert with us today. Transparent communication is key to all stakeholders. And I have seen and heard about numerous examples of this in many, many jurisdictions. So I applaud your efforts in this regard. And as you probably know, there is a natural tendency for entities to become very insular under scenarios like this. Evaluate the use of existing common space as a housing alternative to promote social distancing. I believe you will have access to some recommendations through Mass Design, an architectural firm that has stepped up to the plate, and they're willing to help any entity within our country that wants to take advantage of common space options. Obviously, limiting facility movement at its best that you can, and have quarantine protocols in place for any new admits and transfers is a good idea. Now is the time to limit facility transport as best you can, especially for incarcerated persons being transported from a facility where the disease is known to be evident. And we all know the vulnerability that can occur with that. Work with the front end entities of the criminal justice system, as Mike was talking about earlier, such as the judicial branch, and as best you can limit new admits, and ensure that your respective emergency command centers, or whatever you call them, have qualified health professionals on board to ensure and advise you on potential health implications of your decisions. Know your potential vulnerabilities, equipment inventory, staff deployment limitations. Consider your options of what you will do if your staff resources are depleted to crisis levels. I've heard of some entities that are calling out to retirees to come on board in the event that this occurs, and it is likely to occur. Ensure that someone is dedicated to monitoring ever-changing recommendations as it relates to CDC guidelines. And as I hope you are aware, the CDC does have posted recommendations pertaining specifically to correctional environments. Ensure that you are effectively documenting every aspect of what you are doing. I think this is really important. I think that we all have much to learn from you when this is over. Ideally, you should dedicate qualified staff to assist those most vulnerable on the front line of this situation. Obviously, fear and anxiety is challenging, and it's here right now. I would consult a mental health expert. Lastly, I will offer my last piece of advice at this present time, and that is to say that without a commitment to public health under these circumstances, there is no public safety. You will get through this, and don't forget to acknowledge your success, because there will be success under these extraordinary circumstances. And know that more than ever, share your stories, because we all need some semblance of hope. So thank you.
Good afternoon. I'm Andre Stansel. I'm the one of the deputy directors in the state of Colorado Department of Corrections, and I want to echo what my colleagues have said. I really appreciate the opportunity to come before you and share some of the things that we're doing out in Colorado. This is a very unusual time for us. You know, what we're dealing with is an out of the box epidemic, outside the box epidemic, and what we've realized is taking outside the box ways of addressing it. You know, one of the main things that we learned early is that we couldn't allow security to keep us in the box thinking. You know, we have to maintain the security focus. However, we have to look at creative ways of getting and dealing with such a unique issue. So last week we were blessed with the executive order that came down from Governor Polis, and in this executive order, it gave us great flexibility on how we can manage our facility through this tough time. Probably the most immediate impact that it gave us was it gave us our ability to monitor our intakes. So what the executive director, Dean Williams, did was he put a moratorium on new intakes coming from county jails. Well, as you can imagine, this was unprecedented, but it was also one of those things where when we did it, we knew it wouldn't just impact us, it would impact the county jails as well. So one of the ways that we addressed that concern was we contacted each individual county, no matter how small, and we spoke to them about the plan. We spoke to them about the moratorium, and we talked through some challenges and some situations with them, because we know that we're not the only ones that are looking for ways to address this. We know that we're not the only ones that you know, our populations are swollen, and we're all looking for ways to reduce our population, and a lot of the county jails depend upon us to get those new intakes. But we were able to speak with all of them and explain and work around some major issues. A lot of the other things that executive order did was it gave us the opportunity to create appropriate guidelines and criteria for suspending earned time credits and suspending statutory criteria around special needs parole. It broadened our authority to place inmates in ISPI. And so it gave us a lot of tools to create to free up some bed space inside of the facility, because like my previous two colleagues have said, that's going to be important down the road in the event that, you know, the pandemic does reach inside of our facilities. As of the beginning of this webinar, I'm happy to say that we have yet to have any, you know, inmates test positive for corona. We have quite a few that's quarantined for symptoms, but luckily for us, we haven't had any positive tests on the incarcerated people side yet. Unfortunately, we've had I think 3 at the time of this webinar. We had 3 staff that have tested positive for the coronavirus, and I'll speak more to that a little toward the end of my presentation. So what are we doing? What are some of the things that we're doing to assist or to get through this pandemic? Well, we kind of broke it down into a 3-phase project. And the first phase was, this is when it initially started, we started educating our incarcerated population as well as our staff. And we did that many ways. Our director he was doing written notices and writing information himself that we provided to all of the inmates, all of the incarcerated people. We gave hard copies, we put it on their inmate televisions, we put it on, you know, we made it available to all of them so they could ask questions, you know. But before we went that route, you know, the most important thing was communicating with the staff and getting the staff to understand the magnitude of what we were facing. And going into it, none of us really knew how significant this was going to be. We were following the news like everyone else. But then we have a great team. We've activated our command center, so we're operating under the ICS command structure. We have multiple briefings a day, and we just gather information and we share information. This is not the time to be working on that philosophy that who has the knowledge has the power. It's very important for everyone to have as much knowledge as possible as we make it through this. So once we got to the point, we had a scare with a staff member in our headquarters, and so we enacted phase 2, which phase 2 was our social distancing plan. So one of the things that we had to do with that was develop alternative schedules. So in the headquarters, it wasn't that difficult. We had certain staff that were deemed as, staff that needed to be there. They were essential staff. So they were able, some of them were able to stay in and continue to work. But the others, we all were working remotely. So that came about with making sure everyone had the proper equipment, everyone had laptops if needed, everyone had some means of, whether it's Citrix, whether it's VPN, some way of communicating and some way of accessing all of your documents as if you would be in your office. So we're able to do that from home. And then we had to figure out a way to do that same thing in the facilities. So some of the schedules we developed, and it arranges based upon the facility. We allowed the wardens to develop their own schedules that they thought would work best for their facilities. Some of them went on like the A team and B team schedule, where the A team works, certain days a week, and then the B team works certain days a week. But we felt it was important to create that social distancing, because we knew, like everyone else on this webinar knows, that the great thing about working in a facility or working in this environment is we control a lot of what comes in and out of the facility. So we knew the chances, if it got inside the walls, it was going to be because of one of us, someone that's coming in, is bringing it in. So the way we did the social distancing to try to manage that, and we also we ceased all visiting. Now, that was a significant move because in times like this, where it's stressful and incarcerated people are stressing, the staff are stressing, the last thing you want to do is isolate the incarcerated population from their families and loved ones. However, we knew that was important to try to manage that and keep it out of our facility. So to help with that, we began doing video visiting. It was something that we have been looking at for a while, but we really hadn't pinned it down. But we were able to pin it down and get that video visiting going. And we use video visiting for social visits. We use video visiting for legal visits. Let's see, we also had to address the training needs of staff. So we gave waivers in certain areas that we could, but in those areas that we couldn't, we had to develop ways of continuing that training, but still maintaining that social distancing. And we were pretty creative on that. Let's see. So to kind of wrap up a couple of things, and I know I barely touched the surface of a lot of the things that we've done, but for the sake of time, I want to make sure we stay on schedule. So here's some of the things that I recommend that you not do in times like this. We didn't believe, and we looked at it, we didn't believe that going straight into a lockdown was the best answer, because we knew at some point, once they got inside the walls, that was something that we were probably going to have to contend with. So we wanted to extend that national lockdown or statewide lockdown as far as we could. I said this earlier, we didn't allow the security needs to keep us inside of a box or limit how we approach some of our responses. And then the last thing is communication, and that's key. You must communicate. because it lowers stress. And that communication is with staff, with incarcerated people, with their families, with attorneys, with everyone. So I know I didn't get really down into the weeds on a lot of the things that we did, but I just wanted to give an overview of some of the things that Colorado has done and is continuing to do as we move forward. So at this time, I'll turn it over to Richard Cho.
Great, thank you so much, Andre, and thanks to the organizers at Restoring Promise for including me in this webinar. I've been asked to speak a little bit about what support is available for people leaving prisons under COVID-19 with a focus on housing. This is something that we've been working closely with our state Department of Correction here in Connecticut on, along with other criminal justice partners. But I'm going to just be the voice of a little bit of caution and concern, because there aren't really exactly easy answers at this time. Let me share that even before the COVID-19 pandemic was something that really has taken over the focus, we had been working closely with our state criminal justice partners on helping address the problem of homelessness after people were leaving incarceration. And what we had determined was that over the course of a year, roughly 1,200 people were leaving Department of Corrections and winding up homeless using homeless shelters in our state. And we had been working with our state criminal justice partners, Department of Corrections, Office of Policy Management, and others to determine how we can actually prevent homelessness and think through strategies for identifying which people who were being discharged from prisons or jails were likely to become homeless or return back to homelessness, and to develop housing strategies and policies to address that. Of course, everything has changed with COVID-19. First and foremost, we are now working in a process to try to reduce the number of people who are entering homeless shelters because of the fact that homeless shelters as another congregate setting could potentially be a place where COVID-19 could rapidly spread amongst the population. People are sleeping in beds that are very close together, often many people in a single room. And so we've been working with our state to figure out how to decompress our shelters, move people into hotels, spread them out as much as possible, and follow the CDC's guidelines for social distancing for congregate facilities. I share that because right now, any of the types of programs that people who don't have a stable home plan, who are leaving prisons or jails, would normally have access to, are being closed down. Halfway houses are reducing their admissions. Transitional housing and recovery housing programs are also reducing admissions. Some of them are also closing. And we, with our homeless shelter system, have also dramatically reduced admissions, and are also in a process of moving people out of shelters and into other non-congregate facilities. So, as much as I firmly believe in decarceration and the fact that we need to reduce our prison population overall, that's become a lot harder with the COVID-19 pandemic. It doesn't mean we shouldn't figure out those strategies, but it just becomes practically difficult. One of the small things that we've done recently in the last really week and a half is to work with our state criminal justice partners to at least focus on those individuals who are hitting their end of sentences at the end of their Department of Corrections sentence and who must be discharged, where the state has no way to keep them any longer, and at least figure out how do we prevent those folks from either having to be sent to a homeless shelter, again, which we're trying to decompress shelters, or to otherwise wind up on the streets, where that also is a danger with regard to further spread of COVID-19. And so we've been working with them to secure a small amount of funding to pilot practices where 30 days prior to discharge, we're identifying individuals who are hitting their end of sentence and who've been determined to have no other housing options and who also have a history of homelessness. And we are contracting with a number of nonprofit providers across our state to provide assistance through a rapid rehousing model, which means that we have flexible funding to be able to provide rental assistance, security deposits on a time-limited basis. And so the goal will be we'll find interim housing for individuals who are hitting end of sentence, placing them into either shelters or hotels or other facilities, and then eventually moving them into permanent housing with some rental assistance. And again, the challenges are also now that given that the rental assistance is time limited, the focus is on trying to help people find employment. And as everyone knows, that's also become much more difficult as the pandemic has closed down many businesses or businesses have shrunk their services. So we're facing some unprecedented challenges here. It was already hard to help address the post-incarceration housing needs of people who are leaving prisons or jails in our state. It's become almost impossible now to really figure this out. And so I know many advocates in our state have been really demanding that our state develop a plan. And I would say that to those advocates, it's not just enough to say do more or have a plan. I think really the time is now for coming up with some creative and concrete solutions. We really need to figure out not only where the resources come from to be able to address not only housing, but also treatment, services, healthcare, and employment needs among people who are being released from prison, but also like physically, where do we even put them? As a lot of the typical halfway houses programs, shelters, and other housing programs are really reducing their admissions. So I guess my overall message is that we must have a plan. There must be a way that we can address the post-incarceration housing and services needs of people who are being released from prisons. And there is urgency. And of course, we feel this sense that the clock is ticking as the pandemic continues to grow in our state. And you can geographically see how the number of cases is creeping up closer to New York City and spreading northward in our state. And so there's a great pressure to figure out immediately how do we really address any congregate settings, prisons and jails included, and try to reduce crowding. But I'll say that it's a time when we need to really think practically and concretely about what does that look like to actually have a release plan for people, where will they physically go, and how will we put the resources? And I think it's going to take a new level of thinking to be able to address this than previously. As I mentioned, we're putting together a program on the scale of $150,000. It's just a drop in the bucket, and it may be the time to think about between federal stimulus, federal emergency assistance that's being offered, as well as state resources. What are the level of resources that must be brought to bear so we can decrease the potential rapid spread of COVID-19 within our prison facilities, but also not be in a situation where we're discharging people, basically taking them out of the frying pan, putting them into the fire, where their other options are to be in the community, but in other congregate settings where they're similarly at risk, or frankly left out on the streets. So that's my overall message, and I'd be happy to stay on and answer any questions.
Thanks, Richard, and thanks everyone. So go to the next slide. So we're now going to turn to questions and answers for our panelists. We've gotten a few in the chat box, but if you haven't already and you've got a question on your mind, please don't hesitate to type it in and it'll come through to me as we're talking. So the first question is for Andre. What was the third phase of the plan that you talked about implemented? Can you describe the third phase?
Well, okay, so the third phase is the one where it has reached inside the facility, and we have to go on phase 3 staffing, which is minimal staffing. But even when you do that, you have to keep in mind that you have to maintain a resource pool for your staff. You can't just, lock the offenders up or the inmates up and leave them in their cells and just have staff standing around. We're preparing for if that comes. We're hoping that it doesn't come, but if it does come, we're hoping we're planning for the meals. We're preparing for the medical aspect of it. We're preparing for how we're going to quarantine, what areas. We've already decided what areas we're going to use, and just kind of go from there. So phase 3 is that phase that we all hope never comes, but we're prepared in case it does.
All right, trying to find my unmute button. And another question, and Richard, you started talking about this a little, but I'm curious to hear from Scott or Andre, I think, from the audience. The question of are people safer in prison for the community? Can you address that from your perspective as sort of prison operations folks?
I'll take a crack at it. That's the complexity of the issue. and using housing as an example, if you don't have appropriate safe housing for someone, I was making reference to the Council of State Governments article earlier. In fact, you could be making the problem worse from a public health perspective. And so one of the most difficult things is there's a lot of people who are incarcerated for offenses that are not victim related, and may be easier decisions to make if you choose to go down the path of decarceration. The rub is the older population. These are typically people who have been incarcerated for a significant period of time, have been incarcerated for victim-related offenses, and now are older and have health issues and things of that nature. I don't know. I don't have a solid answer as to what the best way to do this would be. My biggest concern, as I made reference to, Dr. Chow made reference to as well, if you're placing people in a homeless shelter, it's not ideal to have them in a communal area where you don't have appropriate social distancing opportunities. What I would do if I was trying to address people who are more prone to having significant illness based on a diagnosis, I would try, if you had the capacity, to maintain them in some single cell type of environment. Provided that you have the capacity, then that would be probably the optimal situation that you could provide in a correctional setting. But in terms of, would it be safer to maintain people in a setting? I'm not necessarily on board with that, but if you do have to maintain people in a correctional setting, do everything that you can to apply the guidelines as it relates to social distancing.
I would have to agree with Scott. I don't think there is a right or wrong answer for that. I think it depends on a lot of things. It depends on your ability to isolate. It depends on your population. There's a lot of things that you have to think about when you're trying to answer that question. Like Scott said, I think if you choose to not let them out, then you must be prepared for all of the quarantines and all that stuff. But if you do, then you have to be mindful of, our primary mission is to protect the citizens. So if we're letting out people that we know to be COVID positive, then are we really doing our task at protecting the citizens? So like Scott, I don't really know if there's a right or wrong answer to that.
Juan or Mike, anything you want to add? Juan, you're muted.
Yeah, I would just say that, you try to do what's most humane, what's most healthful, right? And to keep in mind that aside from this pandemic, that all these individuals that we're talking about, these brothers and sisters, they should be released, and there should be a long-term plan beyond COVID, right? And so I think that we're just beginning to see that, the underinvestment, the lack of investment in public health and treatment and those type of opportunities have really created conditions within prison systems that now it's like, whoops, well, we try to tell you. And a lot of my colleagues on the field, are asking for, mass decarceration efforts. And like I said, there is no right or wrong. But once again, I think it's about prevention. And right now we're just stuck at like, well, we got to do what we got to do in the time being and think about those who are living and working inside of these prisons.
Thanks. One of the things that has come up in the chat box is the notion of if folks could talk about what support has been looking like to prisons, and keeping staff safe, keeping people safe. How is this going to inform best practices in the future so that we don't run into this kind of crisis again? How is what's happening now? And I think, Scott, you're talking about this before, about like write down what's happening because we're going to learn from this. So if someone, you know, whoever wants to take that one, sort of unpack that concept a little bit, what's the relationship?
I'm going to ask Mike to chime in on this as well, because we were having this discussion. So I could speak for Connecticut, and Connecticut has been decarcerating for several years now. And when I started in the tenure as commissioner, the population was almost at 17,000. When I retired in 2019, the population was at 13,000 and change. And when you correlate that up to the crime index report that comes out, you will see that along with the reduction of incarceration, there's continuing to be a reduction in the crime rates in the state as well. And working with Mike, he was able to educate me as to, you know, there is a benefit to what we were doing, and it's not having a negative impact on what crime looks like in our state. And Mike, why don't you, if you could chime in on your thought process on that?
Sure. Can you unmute me? Because I'm not sure I can do it from here. Can you hear me? Yeah, okay, good. So yeah, Scott was saying, just to put it in perspective, I mean, Connecticut has no county jail, so everybody pre-trial and sentenced, they're all in the same Department of Correction facilities. But in 2008, we had 20,000 total inmates. This morning, we have 11,800 and change. So it's been a huge reduction. But this past month, during the month of March, as the coronavirus crisis hit Connecticut, at least, our total correctional population dropped by 500 from the 524 actually from the 1st of March until now. And the reason I bring up that 12-year-long decline in our prison population, plus this very rapid decline over the last month, is that as all of these things happen, the rate of reported crimes actually went down. So in other words, this is an important talking point. I think if you can effectively identify people that don't need to be incarcerated, whether or not they deserve to be is one thing, but do they need to be incarcerated? If you can identify who those people are and properly manage them in the community, then you can also expect to see a reduction in crime. I mean, that's been the very real experience we've had here in Connecticut. And so now that people here are redoubling their efforts to identify people who don't need to be incarcerated. And as I said, going back 10 years, the normal average reduction in prison population during the month of March in Connecticut was 106. This past month, and that's the average for 10 years, March of 2020, the reduction was 524. So that clear evidence that a variety of people using a variety of mechanisms are focused on rapidly reducing the number of people incarcerated in our state. And so an interesting prediction, we'll find out in a few months or maybe next year, did this have any impact on the crime rate? And I think all of our experience here in Connecticut of getting it right and sorting, doing the proper triage on people being convicted and adjudicated for all different kinds of offenses, if you can get it right, among other things, you can expect a reduction in crime. And so to me, this is an important talking point when you're talking to journalists or elected officials, legislators, for example, or victims or anybody else. It's like, it's not as though you're taking a big risk by not incarcerating the majority of people who would normally be incarcerated, that you can actually get better outcomes, save a lot of money, and in a crisis like this, save a lot of lives.
Thank you. So this next question is for Andre. Oh, sorry, go ahead.
Well, Alex, if I could just add to that, I think that's absolutely right. I feel like many of us who've been working with our state partners on trying to address COVID-19 have had to become epidemiology experts like overnight. And, you know, none of us are trained in that way, but this is all about how do you minimize risk for the vast majority of people, not just in prisons or in shelters, but in our whole state. And so, whereas previously we used to make decisions about releases based on criminogenic risk or what their dates were and things like that, at this point, I think what Mike is sharing is let's think about this in terms of what's the easiest way to get the vast majority of people out the door as quickly as possible. And that's, if you're talking about people who have committed crimes that don't pose a public safety risk, and also screening for people who have a stable home plan, so they're not going into other congregate setting that places them equally at risk. Like that's like the kind of risk stratification that needs to happen now. It's not based on what we used to use, but based on what are we going to do to just dramatically reduce the amount of people in those congregate facilities as much as possible. We've been doing the same thing with regard to our homeless shelter population, is whereas we used to prioritize people based on how long they've been homeless or how much disability you have, these days we're figuring out like, how do we just get as many people out the door as possible, regardless of length of the time homeless, and into safer settings. And that's the kind of thinking that I think is needed.
Great. So this next question is for Andre. The question is about what's Colorado doing to reduce contact between staff and incarcerated people? But if you could also address, like, what are some lessons that you're learning that could apply best practice in terms of best practices to other jurisdictions struggling with this, in particular mental health staff contact with incarcerated people? How do you still provide mental health care service without while also minimizing physical contact?
So I was speaking earlier about the phase 2 social distancing schedules. So I know, like, one of the things that we're doing, and for instance, like, let's say we have 6 teachers. We've developed schedules where maybe 3 of those teachers will work, certain amount of days, and during those days that those teachers are working, those are the only incarcerated people that are coming to class at that time. So we're reducing the class size, we're reducing the contact between the staff and the incarcerated people. As far as mental health and as far as Medline and all that, we've modified some of our procedures. There used to be a procedure where, you would have to do the open mouth check and to make sure that the medication was swallowed and they weren't being cheeked. We've developed systems now where that is done behind glass. The incarcerated person is on one side of the glass and the medical personnel is on the other side of the glass. We're still maintaining our care for the mental health population, but we're just doing it as safely as we possibly can, whether that's, doing some communicating through glass, just making sure we create that distance, reducing the class sizes just to enhance that social distancing. So like I said earlier, you just have to be creative. You have to, and because we have so many different missions in our system, each mission will require a certain tweaking of a certain way. And you just have to try to really think outside of the box.
Anything else others would share about that question? Scott, is there anything you'd want to add about what you're seeing nationally?
So a lot of progressive jurisdictions within our country, Colorado being an example, they believe in dynamic security protocols and principles of normalization, where you engage the population in a different way with a humane and dignified approach. And I think the dynamics of that may change in scope, but in principle, you want to try to be as transparent as you possibly can with the consumer. In this case, it happens to be incarcerated people, to explain that the actions that you're taking are in the best interest of their health and safety. So you have staff that are coming in from the outside, the fear, anxiety that comes with that, but it's okay to acknowledge these things and to be responsive to them as much as possible. The population knows what frontline staff care, and those that practice effective communication, transparency to the best of your capabilities, the population will get it. It's human nature. So under these circumstances, the principles that I referred to are difficult to achieve, but you can still maintain some level of transparency that I think everyone can understand.
Thank you. The next question is for Juan. Can you share an update about how the Restoring Promise units are dealing with this? Are they able to maintain, how are they doing? Are they able to maintain the sort of programming, things like that? And Colorado is new to the initiative. They just started. Their unit will be opening later this year, pending everything. But Juan, if you want to comment a little bit on how things are going so far.
Yeah, I think we're literally in the fire with everyone else, right? And trying to do our best to kind of be a pandemic buster. So we've been talking to all the jurisdictions and numerous phone calls, trying to provide, information, best practices, innovations, ideas, anything that can be helpful. We have on our end, we had to stop going in there, right? We come from New York and California. Some of these states had not experienced any coronavirus or anything like that, at least within the prison system. So it would be wrong for us to, pose a significant potentially risk, of not just ourselves, but the staff and the brothers and sisters locked up. So in the process, working on contingency plans, and it's not easy. Like I said, it's like a big hurricane, right? So this at this point is one of the things in the toolbox. We're trying to braid and blend different things, the reality, the audacity, and the complexity. I wish I had a better answer for you, but we're doing like many of y'all the best that we can, and we can be doing more, and we're open to solutions, suggestions.
So we're about at time. I just wanted to give a quick recap and some next steps for our audience members, especially. A couple of themes that I heard throughout this is there's no public safety without public health. And I appreciate that sentiment that Scott shared, that Juan's shared, that others have shared, and really appreciate Scott also emphasizing if decarceration plan isn't on the table, consider one now. Don't get caught behind the 8 ball. Be creative, and just to echo Richard's notion, be creative and propose solutions. It's one thing to say like, do it now. We got to get this done. But what's missing right now is really identifying some creative alternatives, some creative solutions. And Andre's call for don't let security get in the way of thinking creatively and outside the box. We gotta think outside the box when it comes to this. This is all of our first global pandemic that we're in, and we're gonna need all of the best minds thinking about how to move forward from this in a way that creates safety for everyone who lives and works in prisons and in the community. The other thing that I really appreciated everyone talking about, and Mike was sharing about this, we have so much to learn from this. Document as much as you can. It might feel tedious in the moment when you've got so many things going on, but we have to learn from this experience. We have to collect the data. We have to track trends and see what the relationship is between these decarceration efforts and safety, both in and outside facilities. And so to the extent that you are in a position that you can be one of those people documenting things and sharing that information, please do. I also really appreciated Scott's notion of share your stories, because we need some semblance of hope. And I think of Brian Stevenson when he says hopelessness is the enemy of justice. And I think that can be true of all of us, that we all need some hope today, and we all need to work together in this. We'll be sharing this recording of the webinar with anyone who registered, and please feel free to circulate it. One thing that we are trying to do in close collaboration with our partners in the field is collect information and share it and be a resource. So Scott mentioned earlier that Mass Design Group, which is a nonprofit architecture firm in Boston, they put together a wonderful 2-page document about the relationship between design and infection control, and how both in prisons and outside in shelter settings we can be creative in how we're using materials to design for social distance, not social isolation, and people, not just pathogens. And so we'll be sharing all of these materials with people. If you have any immediate inquiries, please reach out to Poonam. Our information is on the slide for a reason. We are a team of people, you know, even those who are currently working in systems, like Andre taking time out of his day to join this. There's a community of people who really want to be resources to each other. We know that none of us can solve these complex problems and challenges and questions on our own, that we need one another. And so please don't hesitate to reach out. We will circulate this information after the webinar concludes. I want to thank our panelists once again for taking the time to join. I also want to thank the participants for taking the time out of your day. I know if you're joining this webinar, it's because you are also busy thinking about these issues and worried and hustling on the outside in the community. To all the incarcerated people and families impacted by mass incarceration and communities impacted by this, you know, we stand in solidarity with you, and we are thinking about all of you, and really hope that, you know, we humbly offered this webinar to ground information in a fundamental foundation of restoring promise, which is human dignity. And so we really look forward to learning about what people are doing and all of our hopes for the future. So to everyone, stay safe, stay home, wash your hands, and we will be following up with this information shortly. Thank you.